My name is Dr. Kwame Ennin. I'm an orthopedic surgeon specializing in hip and knee replacement with the Texas Joint Institute. Really, I went into orthopedic surgery because during medical school, when you're trying out the various specialties, it's where I had the most fun. Every day was an opportunity to make a significant impact in people's lives, and then to get to see the effect of that impact almost immediately. So people who couldn't walk now can walk. People who were in excruciating pain really had significant relief of their pain, and that was very fulfilling for me. I see all types of patients, young, old, all of them have some type of debilitating joint disease. And so my role in their care is to, number one, identify that they have that joint disease, manage that joint disease, be it with surgery or without surgery to the best of my ability, and really utilize surgery as a last resort, but a significant one. My goal is to not be paternalistic. My goal is to not make decisions for my patients. My goal is to educate my patients and help them to make good decisions for themselves. And then if they decide to do something like surgery, my job is to execute.